Worldwide, cervical cancer is the third most common type of cancer for women. It is much less common in the United States because of the routine use of pap smears and the HPV vaccine. Dr. Giovanna Crooks from Boca Raton Regional Hospital is here to tell us much more. Thank you so much for joining us, Doctor. Let's talk about cervical cancer from a medical standpoint. What is the definition? What does that mean for people out here?
Well, cervical cancer is a cancer that originates in the cervix, which is part of the female reproductive system. Much like other tissues in the body, you can have abnormal cells that become cancerous.
Okay. We mentioned two ways that you can kind of check for this early on. Pap smears, HPV vaccine. Expand on those and what those mean for a woman.
Well, the pap smear is basically a procedure that's done by your primary care doctor or your gynecologist, where there are actual samples of the cells inside of the cervix and the area around the cervix, and those cells are sent to the lab where they're looked at under the microscope to see if they are normal or if they have any features of being abnormal.
You know, people hear the word cancer and, you know, pretty much know what that means if it goes untreated. Is cervical cancer any different? Can it really bring on the onset of other things not associated with other types of cancers?
Well, cervical cancer can be very treatable. It has a very good prognosis if it's caught early, but it is like other cancers and can spread outside of the area where it started. So cervical cancer can spread from the cervix into other areas, into the reproductive system and other areas of the body.
We talked about the two methods already with the vaccine and the pap smears. Are there any others out there that women need to know about? Maybe there's something new on the horizon that maybe doctors know about that we don't know about yet.
Well, an adjunct to the routine pap smear is the HPV genetic test.
Okay.
And that's actually a test that tests for the human papilloma virus that is the cause of those cells changing from normal to abnormal. So it's recommended now that that test be done as an adjunct to the pap smear for women who are over age 30.
Okay. How early on is this going undetected? How early on do you suggest that, you know, women get these routine exams and start doing that?
Well, routine pap smear screening, cervical cancer screenings, should begin at age 21 or within 3 years of a woman becoming sexually active.
Okay. And you can't say enough for how much, you know, this can prevent something bad down the line. Anything else you'd like to add on to that?
Well, with cervical cancer, early detection is key. In a stage 1 cervical cancer, the prognosis within 5 years is a 90% or greater than 90% survival. If that cancer is not detected and progresses all the way to a stage 4, it's actually a 15% 5-year survival rate. So it's all about catching it early.
Catching it early, this is really treatable if caught early.
Yes.
Okay. Dr. Crooks, thank you so much for joining us. And Boca Raton Regional Hospital sponsors our expert at underwrites, our Ask the Doctor segment.
At home,